Hi and welcome back. So we are now going to have a look at 2.2, which is describing the roles of the external professionals that work within schools. Um, quite a varied bunch. I hope you've got your PowerPoints with you. I've numbered the slides again so we can keep you up together. The external professionals are the professionals that regularly come into school, but they're not there all day, every day. Um, they often come in for meetings, for assessments. Sometimes they come to advise members of staff if they are experiencing particular issues with a learner. Sometimes they come and spend time with the students, and the sorts of things they do depends massively on the role that they're doing. Um, some of the some of the professionals will come in because the SENCO has invited them in, and they will be professionals that will support children's educational needs and their ability to access them. So they could have people from the hearing impairment team, the speech and language therapist teams, occupational therapists, educational psychologists if they're concerns about a child's emotional health. Um, so these sorts of people will have the need identified. The SENCO will then arrange for them to come in. Other professionals will come in either by the authority, so to fulfil things like school nurses, immunisation programs, height and weight, that kind of thing, monitoring health and hearing. And sometimes it'll be other members of staff that have required them to come in. Sometimes they will, people like social workers will have quite a close relationship with the school. Children spend such a lot of time there. If they're having troubles at home, sometimes, having a safe space at school with other supporting adults can be really beneficial. Okay, so let's have a look at who these individuals are in some detail. So we're going to start off with the Child and Adolescent Mental Health Advisor. I'm sure most of you will be familiar with CAMHS, an organisation that supports young people's mental health. They are a really useful group, but people spend a long time waiting to see them. They don't have enough members of staff often to really fulfill all the need. I mean, mental health is a really large and expanding area with young people. But the things that they can offer, they can offer counselling, cognitive behavioural therapy. They can offer access into other support services like child psychotherapy, family therapy, child and adolescent psychiatry. So often they will come into school to speak to the child, speak to the supporting adults, speak to the teachers, try and get a picture for what's required, and then access some help where they can. Homes, schools and college liaison officers, they also known as education welfare officers, and they, in some schools you will have a home school liaison person that's there a lot depending on the issues you have in your school. So part of their work is to try and understand attendance. So if a child isn't attending regularly, or at all, then they will investigate. They'll spend time with the family. They'll see if it's something to do with transport. Is it a financial thing? Is it issues around uniform? Whatever it is, their job is to regularly meet with parents and schools and to try and understand, what the issues are. They sometimes, work with the police if members of the public are seeing lots of children truanting. They would be involved in greater or lesser depth depending on the school intake. Okay, the school nurse. Now, some schools actually have a full-time member of staff who is a nurse, who will sometimes have another job, like maybe work in reception or the school office or something like that. But on the school nurse in this context is the people that come in to do sort of the annual year 8 girls HPV immunisations, monitor height and weight in primary school, hearing and sight tests when children first start in reception. there will be several first aiders within the school who obviously will be trained, you know, to do emergency first aid. And some, you know, some big schools you have very busy nurses and medical rooms and sick rooms. It really depends on the children. Where I used to work, there was a couple of children who had ME, and you know, there was like a bed, so they could have like a sort of a lie down and a relaxing area. Obviously, special schools where they have children with quite complicated health issues will have a bank of you know, of healthcare professionals. So you know, it really depends on your setting. Now, the role of the PANCO is quite an interesting new addition to the external team. So PANCOs have been developed in response to the government's concern about childhood obesity. And if we look at the projected figures for where they anticipate children's size and weight is going to be, and the cost that has on their health, and therefore the cost that has on the NHS in terms of, you know, diabetes, lifelong health problems, heart problems, you know, in terms of not being able to work, you know, people can become disabled by their size. So the PANCO role has been brought in, working mainly in primary schools, to my knowledge so far, to really trying to get children to make the links between nutrition and exercise and their health. You know, the photograph I put in the PowerPoint of these 5-year-old children, you know, there's one weighing 80 kilograms. You know, there are some very large children, and you know, it has such an impact on their mental health as well as their physical health. So, you know, they're hoping with early intervention, making children more aware, making schools more responsible for the health of staff and students generally, you know, will all sort of feed into a much fitter, healthier, sort of better weight future for these learners. Okay, the next slide is the educational psychologist. Educational psychologists are highly trained professionals. You have to do a degree in psychology, and then you need to do a master's degree. You also need to work in a school for 2 years as well. So by the time you get to be an educational psychologist, you have a lot of good psychological training, but also you will have a lot of experience of working with children. So they will be called in initially to observe children, see how they work in schools, see what kind of issues there are. So it could be emotional, it could be behavioural, it could just be a sort of a gut feeling that something is not right from the teacher. They will support children at home as well, and they will come up with discussion with the school staff on some strategies and some ways of supporting children to try and improve their outcomes. Really interesting, very interesting people. The school that I used to work, we would have a fantastic educational psychologist provided by the local education authority, who would come in once a week to school, and if we were having real issues with students and we were trying, you know, lots of different strategies and not really making any headway, then they had such a wealth of information and good ideas and things to try. They were such a valuable asset. There's the next clip will give you some, the next slide has got some clip details about an educational psychologist. That's quite a useful thing to look at. Social workers is our next group. So they can be involved with a student if there are welfare or social needs, and so that could come from child services, their involvement. It could also come from other areas. If there are concerns that a child is in danger of neglect, or if there are issues around housing or food or shelter, if there's been a safeguarding incident, there's all sorts of different reasons. Again, it could be an attendance thing. There could be lots of reasons why a social worker will become involved. Social workers, you know, will deal with the whole family, but sometimes, you know, school's a really safe place to speak to children when their parents aren't there or other members of the family aren't there. So it's not uncommon to have little meeting rooms within schools where you know, learners will be meeting regularly with social workers or youth workers or any of these other professionals. Okay, moving on to the SALTs, the speech and language therapists. In some special schools, you will have full-time SALTs. More commonly, in mainstream schools, you will, you know, there's a really high proportion of children who do have some speech and language and communication difficulties. Early intervention is absolutely key to improving their outcomes. So seeing SALTs coming in and going through exercises with children, you know, it's not uncommon. The earlier the better. So you will see a lot of them, in primary schools. Primary school children will often be taken out of school to have SALT appointments in hospitals or other centres. Sometimes in secondary schools, where children have had things like surgery for cleft palate operations, not all of those things can happen in the early years. So sometimes they have to wait for jaws to grow and before they can perform some operations. So, you know, you will see them coming in and helping children. I've worked with some kids who are helped enormously through SALTs. They can really dramatically help progress. You know, if a child is self-conscious about speaking or not being understood, then, you know, often they will be reluctant to say or do anything or contribute to anything. So, you know, they have a really useful role to play. There is a nice little clip about a speech therapist working with a little lad called Dylan, which I've included for you. There, and that there ends our whistle through external professionals. You will find some activities which will support this, which will help you focus before you get to do your assessment piece. I hope you find it useful. I hope you're all keeping well. All right. See you soon, ladies.